get back to this vaccine news and talk about getting the vaccines where they're needed most. Brandon Daniels joins us from Exiger, president of global markets there. And, Brandon, maybe a quick word as we start, because we're going to talk about the logistical challenges here about the transition from one president to another and the challenges that might pose. You think there will be issues because we have so much encouraging news now with these 3 vaccines?
So, Connell, the news is encouraging, and it is not a miracle that it is so. It was planned to be so. It's a miracle that the results are this good. But when speaking about the transition, the amount of infrastructure that we've set up for things like coronavirus testing, where you have mobile units, you have pharmacies, you have essentially urgent care facilities that have been set up to reach populations that would otherwise be difficult to reach in a public health crisis like this. The transition is largely afforded because, or is largely balanced by that current infrastructure, right? That existing infrastructure that's been set up by the Department of Defense, by DHS, by HHS, by the interagency groups, can really be utilized as we move into the vaccine distribution phases. And you've seen that in the comments made by the CEO of CVS, by the leadership in Operation Warp Speed. And I believe that is what is going to be the bedrock of the transition plan, and will also be the bedrock of our capability to continue the good work that Operation Warp Speed has already done.
All right, so let's talk about that a little bit. So it sounds like you think we're in a pretty good position, that we're set up pretty well, largely because of Operation Warp Speed. Next things we should be watching for are what? I mean, the whole idea is to get this vaccine or vaccines where they're most needed. So I guess that starts with healthcare workers. How do you think it'll play out here over the next few weeks and months?
So the interesting thing here is that each of the vaccines has benefits that you can leverage and different aspects of the vaccine that require different logistics. So what you may see, Connell, is, for instance, the Pfizer vaccine, which requires a different degree of inherent logistics to be distributed by large healthcare centers. You might see that in a greater quantity in hospitals, in state-run healthcare centers that have set up to distribute the vaccine to largely populated areas. You then might see things like the logistics around Moderna allowing for longer shelf lives, and then therefore companies like CVS and other pharmacy companies being able to distribute those vaccines because they have the infrastructure to do so. And then when you see the global expansion of the vaccine, you might see a vaccine like AstraZeneca coming into play, where they have larger international production facilities that can potentially reach billions of doses.
Final thing here is timetable, which is still something of a guess, but are you comfortable with saying that, all of us who want to be vaccinated will be able to do so, say, by the spring, by April of next year? Is it a little further out than that? How do you see that now, knowing what you know?
So I think that the at-risk populations should be hopeful that they will be vaccinated by the spring, by maybe mid to late spring. I think that the general population reaching that sort of herd immunity point is more looking like the summer. But with that, I want to add in one caveat. The at-risk population is who we're trying to reach here, right? What these vaccines across the board have shown is that the most severe cases were prevented by all of them. So not just that you reduced infection, not just you reduced symptomatic cases, but that you reduced hospitalizations and severe cases, which are what put the most severe strain on our economy, Connell.
Right, and we see that in so many parts of the country now, but we also see the light at the end of the tunnel that you and I are talking about as well. Brandon, thank you. We appreciate it. Brandon Daniels with us today. Big news today from the Biden